Hi everyone, so this is the second part of the recorded lecture for the pathologies of the urinary system. But before we proceed with the continuation, let us review first the physiology of the urinary system, specifically on how the urine is formed. So our kidney has a functional unit that is responsible for forming and excreting urine, and that is nephrons. So inside the nephrons, we have glomerulus, Bowman capsule, and convoluted tubules. So ang nangyayari inside the nephrons is that it filters out the blood and cleans its impurities. So nangyayari siya inside the glomerulus. It is a ball-like cluster of specialized capillaries, and again, it filters the blood and cleans its impurities. So after na ma-filter si blood, it enters the Bowman capsule and goes to the convoluted tubules in form of urine. So that is how the urine is formed inside the nephrons. Now, how is it excreted from the body? So let's say this is the kidney. Pangit ko mag-drawing, sorry. So, nephrons can be found inside the renal pyramids as well as the collecting tubules. So, once the blood is filtered out from the nephrons and naging urine na siya, it enters the collecting tubules and then goes through the minor calyx and then enters the major calyces, passing through the renal pelvis and through the ureters, going to the bladder, and then it is excreted out from the body through the urethra. So that is how the urine is excreted out from the body. And now let's proceed with the continuation for this recorded lecture. For urinary system calcifications, we have renal calculi. These are the stones that develops from urine and precipitate crystalline materials, especially calcium and its salts. So the factors that cause this precipitation is hyperparathyroidism, excessive intake of calcium, and metabolic rate that causes high urine concentration. So this is developed more often by men than women, especially those who were 30 years old and above. Renal calculi often visible on the radiograph as it appears as a radiopaque. Here is an abdominal radiograph without IV contrast that demonstrates a large staghorn calculus. A staghorn calculus is a large calculus that assumes the shape of the pelvic calyceal junction. So next is the renal calculi. So generally, they do not have a smooth texture and often have multiple jagged edges. So because of this, it causes pain as they move through the ureter. So there are 3 points at which kidney stones usually become lodged. One is the ureteropelvic junction, second is the pelvic rim, and last is the ureterovesical junction, which is the most common site for a calculus to lodge and create an obstruction. So the signs and symptoms of a renal calculi includes hematuria, fever, chills, frequent urination, and secondary infection. Sometimes, if the renal calculi is very small, it is excreted out from the body with the urine. But if it is not passed, either lithotripsy of the stone or surgical excision of the cause of obstruction is necessary. A shockwave lithotripsy is often used to crush calculi less than 2 cm in diameter located in the renal pelvis or ureter to prevent obstruction. Now let us proceed with the degenerative diseases of the urinary system. First, we have nephrosclerosis. It involves intimal thickening of predominantly the small vessels of the kidney. So it is part of normal aging process. So the treatment for this could be managing hypertension, administration of diuretic agents, and use of proper dietary restrictions, for example, a low sodium diet. Next is renal failure. So this usually represents the end result of a chronic process such as chronic glomerulonephritis or polycystic kidney disease, and it gradually results in diminished kidney function. So the signs and symptoms for this disease includes anemia, hypertension, heart arrhythmia, congestive heart failure, and severe electrolyte and acid-base imbalances. So the treatment for renal failure consists of dialysis and possible transplantation. One characteristic of renal failure is uremia. It is the retention of the urea in blood. Next, for our degenerative diseases is hydronephrosis. It is an obstructive disorder of the urinary system that causes dilatation of the renal pelvis and calluses with urine. So the causes are calculus, congenital defect, blockage of the system by a tumor, stricture, and blood clot or inflammation. So patients with hydronephrosis sometimes experience flank pains and blood or pus in urine. Now let's proceed with the neoplastic diseases. First is the renal cysts. So they are usually asymptomatic and do not impair renal function, but they may cause symptoms from rupture, hemorrhage, infection, or obstruction. So they are commonly found in the lower pole of the kidney and are readily demonstrated with CT, MRI, and sonography because cysts have sharply defined margins. Most cysts are asymptomatic, but if treatment is needed, an aspiration of the cyst contents is usually performed. So next is the renal cell carcinoma, the most common malignant tumor of the kidney. So this is 2 to 3 times more frequent in men. So it is an adenocarcinoma arising from the proximal convoluted tubule. So the risk factors for this RCC is chronic inflammation from obstruction, cigarette smoking, obesity, hypertension. The signs and symptoms of a renal cell carcinoma includes hematuria, flank pain, fever, and palpable mass. So the CT scan is most useful in demonstrating the density for the renal cell carcinoma. Next is the Wilms tumor or the Nephroblastoma. It is a malignant renal tumor found in approximately 500 children per year. So invariably diagnosed before 5 years of age. So often, they have no symptoms but may have the tumor discovered by a parent or physician who feels a large palpable abdominal mass. So for Wilms tumor, the abdominal CT scan is the modality of choice for the diagnosis. And last is the bladder carcinoma. It is 3 times more often in men after 60 years of age. So this is caused by cigarette smoking and certain industrial chemicals. So the main symptom for this disease is painless hematuria. So the bladder carcinoma may be classified as urothelial carcinoma, formerly known as transitional cell carcinoma, squamous cell carcinoma, or adenocarcinoma. So usually, bladder carcinoma is located in the area of trigo. These are the pathologies of the urinary system, and if you have questions or clarifications with the topic, just leave me a message. Thank you so much for listening.